In the past, what we've seen is that one technology has been bought for everybody, and that one technology has been distributed to that community. What we're now able to do is say, okay, we now recognise that that's a myth. Let's look at an ecosystem of technologies and deploy the right technology for the person who needs it. And if I give you a really simple example, if you take 3 people and they're all waiting for mental health support for anxiety, now, even if we just take us 3, I can guarantee you that the same technology won't meet our individual requirements. And that quite often that's based on personal preference. So I'll share with you one of my personal preferences for technology. I don't want to engage in social networks. It's a personal preference. Loads of people really benefit from that. But my personal preference is I don't want to do that. So whereas you might find that you do want to do that, you might also want something that you engage with very readily. I might want something that I deal with at point of crisis. Now, as I said, we've got all the technologies, and because ORCHA have been assessing, evaluating, gathering this information for over 10 years, we now have this major repository of information on that marketplace. And because the technology has matured so much in the NHS, we can now just plug in that knowledge and via simple text messaging service, which we're all using, receive questions and receive bespoke interventions which are targeted to meet my personal preferences. And one of the things I loved that Richard said earlier was, of course, the workforce is stretched, but the workforce isn't trained in all these technologies. It's mammoth. And so by using a technology platform, we can do this automated distribution without clinicians needing to spend, and it wouldn't just be hours, it'd be years and years of learning to learn about all these technologies.